High cholesterol causes 4.4 million deaths every year. It is more than all world's deaths in the world combined over the last 10 years. It happens because cholesterol is responsible for about half of all heart attack cases. Without cholesterol buildup, blood vessels would not be clogged, and in most cases, heart attack would not happen. But most people ignore this problem because high cholesterol has no symptoms. When symptoms appear, it is usually too late. High cholesterol affects almost every second adult in poor countries and in rich countries. It is a universal threat for humanity. Half of all people who try to lower their cholesterol level still fail because they repeat the same 7 mistakes over and over. That's why today I will show you which one sabotage your effect. Generally, cholesterol is not poison for us. It is fat-like molecule. We need cholesterol for hormones and for cell membranes. Cholesterol inserts in the cell wall and keeps cell flexible, not fragile. We also need cholesterol for nerves. It protects nerve with the myelin sheath, which is rich in cholesterol. The problem starts when bad cholesterol, or LDL, is high in the blood. It penetrates the artery wall. LDL particles are oxidized there. This damages the artery wall and starts inflammation. Then chain reaction begins. Immune cells come. They cause more inflammation, more cholesterol deposition, and finally cholesterol plaque develops. The first and one of the most important mistakes is that people mostly rely on diet only, not on medications when they are needed. Because actually the diet accounts only 25% of cholesterol. About 75% is made in the liver. The diet alone can reduce cholesterol by only about 10%, and in many cases it's not enough. So medications called statins are mandatory if bad cholesterol, or LDL, is more than 190 milligram per deciliter. At such high level, there is very high risk of premature heart attack. Also, medications are strictly recommended when hypercholesterolemia is genetic. In this case, even statins alone are often not enough. And if a person already had a heart attack, angina, stroke, stent, or bypass, they require medications. And if a person already has diabetes, because it triples cardiovascular risks, in this case, statins prevent silent progression, even if LDL is only mildly elevated. The second mistake is when people start to eat less fats, like butter and cheese, but they increase eating of sugars and simple carbohydrates like bread and bakery products. Actually, sugars are also converted into triglycerides in the liver. It is called de novo lipogenesis. They are then packaged into VLDL. It's called very low density lipoprotein, which is very bad cholesterol and unfavorable combination. As a result, we get picture with high triglycerides and low good cholesterol level, HDL. This is powerful driver of heart attack and heart disease, even if total cholesterol looks near normal. So if your triglycerides are high, more than 200, it means you eat too much sugar and you should be careful. Also, it can be a sign that you have insulin resistance. The third mistake is irregular use of medication. Statins directly lower bad cholesterol, LDL, production in the liver. They lower LDL by 30%, sometimes much more. But if you stop taking them, cholesterol will rise back within several days. These medications are commonly used lifelong. The fourth mistake is you don't lose weight. Even losing 10 pounds, around 5 kilograms, can decrease cholesterol around 15%. So staying overweight blocks cholesterol improvement. And fifth mistake is when you have other disease but don't control them. For example, hypothyroidism. When thyroid hormone is low, there are fewer LDL receptors in the liver and LDL rises in the blood around 30%. Diabetes is another important condition. It pushes the liver to make very bad cholesterol called VLDL. It creates a pattern: high triglycerides, low good cholesterol, and small dense LDL. This small dense LDL is a subtype of LDL. It's very atherogenic, which means very dangerous for the heart. Liver disease and kidney disease can also cause high cholesterol due to reduced clearance and liver overproduction. And sixth mistake is to forgetting genetics. Some people live perfectly healthy, slim, active lives. You still have sky-high cholesterol. It's genetic mutations in LDL receptors, ApoB or PCSK9, cause familiar hypercholesterolemia. In familiar hypercholesterolemia cases, the liver cannot clear LDL particles properly, and we have LDL which stays very high from birth. Plaques build silently, and lifestyle alone never normalize cholesterol. In genetical hypercholesterolemia, LDL is usually very high, more than 190 milligram per deciliter, even in childhood, and in adulthood often higher than 250 milligram per deciliter. And seventh mistake, doctors may ignore the genetic basis if LDL is not too high and does not fit classical familiar hypercholesterolemia. But in about 20% of population, even with normal, healthy, athletic lifestyle, diet, no overweight, but they still have high LDL cholesterol level, between 150 to 180. Elevated, but not too extremely high. In this case, we should consider polygenic hypercholesterolemia, a milder genetic variant, and it's very common. At this stage, recommendations are reduce saturated fats like butter, cheese, red fatty meats, coconut oil, and replace them with unsaturated fats like olive oils, nuts, fish. Increase soluble fiber like oat, beans, psyllium, and avoid trans fats and processed foods. If LDL remains above 160 after lifestyle trial, statin therapy is guideline recommended, even in young, low-risk adults, because cumulative lifetime risk is important. The lower for longer, the better. Atorvastatin and rosuvastatin are the most used. They have safe long-term data and reduce LDL around 30 to 50%. And bonus, lifestyle blind spots are alcohol, smoking, and sleep. Alcohol raises triglycerides, smoking oxidizes LDL, and poor sleep and stress rise cortisol, which increases LDL, and patients often miss these contributors.